my name is Kennedy Patterson, and my partners were Jacob Loomis and Tanner Milliken, and I'm going to be telling you a little bit about dehydration today. So dehydration is caused by not drinking enough water, and all of the causes underneath that are usually due to loss of electrolytes, water, fluids, or just other minerals. So excessive sweating. This can happen through vigorous exercise, such as like sports practices, or exercising a lot, or working outside, as you can see in the picture. And lack of safe water to drink, such as if you're hiking, camping, or traveling. Diarrhea and vomiting also lead to a big loss of water and other fluids in the body. And fever can also increase those symptoms. And then lastly, increased urination, and with that also medications such as diuretics, because they increase urination as well. So some of the symptoms are feeling thirsty, and this happens because when you're dehydrated, the thirst center in your brain is triggered. Also darker urine, because when you're dehydrated, the kidneys tell the body to retain water, but they're still filtering out the toxins, so the concentration of your urine is going to make it darker. Urinating less than normal because there's less fluids to pass. Lightheadedness or dizziness, because there's not enough blood and oxygen coming to the body as there normally is. Confusion, because the brain cells can't function properly when there's not enough oxygen coming through. Headaches, and also fatigue, because the body's working extra hard to make sure that it's getting everything that it needs. So for diagnosis, a lot of times doctors can just look at the signs and symptoms, and if there's not any other severe symptoms that are taking place, they'll usually treat it as dehydration. They can also do blood tests, which will show the amount of electrolytes, and specifically in this case, sodium and potassium are really important to check for. And then lastly, they can do a urine analysis, which can help show whether you're dehydrated and what degree based upon the color and the levels of fluid in the body. And then also there's a few other in the pictures there that they might use to diagnose if needed. So for treatment, it really depends on age, severity, and cause. A lot of times they'll just replace the fluids and electrolytes that were lost in your body, but it does depend on the way that they do it. So for infants, they can do oral rehydration solutions. For children and adults, they just usually encourage to drink more water and sports drinks to get the electrolytes back in the body. And if it's a more severe case, they can do intravenous fluids, where they'll pump salt and fluids back into the body, and this allows to be absorbed quicker and a faster recovery. So for risk factors, it's really important to know the risk factors and prevention that can be taking place for dehydration, because it is so common. So for infants and children, they're the most likely to get dehydrated because of two reasons. The first one is because they can't communicate as well. So especially infants, they have no way of communicating what's wrong or what they're feeling. So it's harder to tell what's wrong. And for children, vomiting and diarrhea are also a very high cause, and also sweating, because they're outside playing around and getting involved in activities, and also their immune systems are building, so they do get sick a lot easier. And for older adults, as you age, your body's fluid reserve becomes smaller, and your ability to conserve water is reduced, and your thirst sense becomes less acute, which is why older adults are also at higher risk for this. And also people who have common colds or sore throats, because they can have a loss of appetite, and like less desire to drink water. And then also people who work or exercise outside, again, because of the sweating. If it's humid in the air, your sweat can't evaporate and cool you down as much as it normally could, so your body temperature increases, and then that does cause sweating more. And then prevention, just simply drinking enough water and getting enough electrolytes, and eating food that's high in water, such as fruits and vegetables, and just being cautious of how long you're spending outside and the amount of water that you're drinking, like equivalent to how much you're working out or sweating. And then lastly, for prognosis and follow-up, dehydration is a very good prognosis as long as you follow the precautions needed, such as drinking water and listening to your doctor if there's any other things that you need to do. And no follow-up is needed either, as long as your symptoms stay away. If they come back or are reoccurrent, then your doctor can make a treatment plan that's good for you. And these are our references, and so you can ask me any questions or check these out if you need more information.